Hello, everybody. Welcome back. This is MJ, the coding coach, and I am here with another lesson. Tonight, we're going to go over ICD-10 coding and a few shortcuts that I learned along the way as I was reviewing medical charts, and I just noticed something. And I'm not sure if all of you guys know, but it's definitely something I wanted to present and to share with you guys because it kind of helped me alleviate or eliminate time when I was researching things. Of course, I will always verify via my ICD-10 book just to make sure I'm correct, but it also just helped me just know where exactly to look in my book. So tonight's agenda, we're going to go over laterality shortcuts, unspecified codes, commonalities, and we're going to talk about ulcers, pressure and non-pressure ulcers. So in this presentation, I will highlight the various commonalities and the shortcuts with various ICD-10 code categories. As you learn and understand diagnosis coding, you will grasp concepts to assist you with eliminating time by remembering ICD-10 codes and or knowing exactly where to find the diagnosis codes in your book. Again, we always have access to so much software, encoders, our books. Now, we do not have to memorize these things. However, just knowing some of these shortcuts, again, will help you save time and just help you learn your ICD-10 codes. So first, we'll go over the laterality shortcut commonalities. So first, we'll talk about the diseases of the eye. Actually, these codes here were just added to the 2024 edition of the ICD-10 book. These are actually brand new codes that were updated as of October the 1st, 2023 for the 2024 fiscal year. So let's first go over H36.811, which is non-proliferative sickle cell, retinopathy in the right eye. H36.812 is the same disease, the non-proliferative sickle cell retinopathy, but this time is in the left eye. H36.813, non-proliferative sickle cell retinopathy, bilateral eye. H36.819, non-proliferative sickle cell retinopathy, unspecified eye. So I wanted to show you this trend when it comes to the eyes, the ears, and the breast when we're talking about neoplasm. Again, you might see a lot of cancer codes if you work in oncology. If you work, in an eye doctor or something like that, you might see these eye codes. And also, if you work with the audiologist, you might see a lot of these ear codes. So these are things to remember when you're coding. If it ends with a 1, now this is for the eyes, the ears, and we're talking about the breast when we're talking about laterality commonalities. So for the eyes, if it ends with a 1, it's going to be the right eye. If it ends in a 2, it's going to be the left eye. If it ends in a 3, it's going to be the code for bilateral eye. If it ends with a 9, that means that the provider did not specify in the documentation, and you will use this code for unspecified eye because you're not sure if it's the left eye, the right eye, or both eyes. Since you're not sure and it's unspecified, you would use this code ending in the 9. Excuse me. So let me show you again how this trend is all throughout the eye category. If you turn to your 2024 ICD-10 book, if you have the AAPC version, if you turn to page 647, and we're going to look at the H40.3 category, which is glaucoma secondary to eye trauma. Now, if we go down a little bit, we see that the H40.31, and of course, it says we're going to need 7 characters for these codes. 7 characters. And it's giving you the description of what you need to do in the different stages for this condition. But I want you to primarily just look at the codes H40.31, H40.32, and H40.33. You see the 1 is signifying the right eye, the 2, the left eye, and the 3, bilateral eyes. You see that? Pay attention to that trend. And if you go all through your category for the H's or chapter 7, you will see this trend. Again, 1 for right eye, 2 for left eye, 3 for bilateral eye, and 9 for unspecified eye. So let's talk about the ear and mastoid process. Let's talk about the ear and mastoid process. This is going to be in chapter 8. Although it's still the H category, it's broken down. It's broken down from H00 through H59 as far as chapter 7. And chapter 8 is H60 through H95. So now let's talk about swimmer's ear. Now we just talked about the eye, so let's talk about the ear. You see 1 again at the end, right ear, 2, left ear, 3, both ears, which is bilateral ear, and the 9, unspecified ear. So now let's talk about neoplasms. When we're talking about cancer, neoplasm, things like that, there are different stages. I'm sure you've heard somebody say, oh, she has stage 4 cancer. She has stage 2 lung cancer. She has stage 3 breast cancer. So of course there are different stages. So let's talk about these things here in regards to neoplasm. Benign. Benign is a word you may see often. Now, a lot of these you're going to see if you're dealing with oncology, neoplasm, cancer. You're going to see benign, in situ, malignant, neoplasm of uncertain behavior, or neoplasm of unspecified behaviors. And let's go through and talk about these things and the differences. So benign is when a neoplasm is characterized by the absence of atypical malignant cytological architecture features, which means there are no malignant cells. These cells do not invade neighboring tissues, nor do they metastasize. That means they do not spread. The word in situ means that its original place. These in situ cells are not malignant or cancerous. However, they can sometimes become cancerous and spread nearby. These are what we can also often call precancerous cells. So malignant tumors are cancerous, and they can spread. They can spread. Malignant means cancer cells. It's cancer. It's there. Malignant tumors are cancerous and can spread cancer cells throughout one's body through the blood or lymphatic system, a process known as metastasis. Or when it's metastasized, it's spreading. That's what their words mean. Neoplasm of certain behavior. So sometimes people get it mixed up with neoplasms of uncertain behavior or neoplasms of unspecified behavior. So neoplasms of uncertain behavior is looks like a typo, is a growth whose behavior cannot be predicted. This diagnosis is only reached after a biopsy is obtained and examined. Now, neoplasms of unspecified behavior is a term documented when a pathologist is unable to diagnose the mass as benign or malignant. Okay. So let's talk about the different stages of cancer. Cancer is typically labeled in stages 1 through 4, with 4 being the most serious. These broad groups are based on a more detailed system to determine how it affects the rest of your body. Stage 0 means there is no cancer, only abnormal cells with the potential to become cancerous. This is also called carcinoma in situ. Stage 1 means the cancer is small in only one area, and this is also called early stage cancer. So if someone says they have early stage cancer, this is typically stage 1. Stage 2 and 3 means the cancer is larger and has grown into nearby tissues or lymph nodes. And stage 4 means the cancer has spread to other parts of the body, and it's also called advanced or metastatic cancer. So let's next talk about the commonalities of the Neoplasm codes. So if you see here, same thing applies. 1, 2, and 3. So the difference here is 9, like we had a 9 when we talked about the ear or the eye, and there was the unspecified code, of course. Let's talk about this and let's break this down. The 1 on the end, this is the right breast. The 2 on the end, this is the left breast. The 3 here is unspecified breast. So remember when we talked about the ears and the eyes, the 9 on the end, which meant the unspecified for those categories. Well, as you see here, if a patient is diagnosed with both left and right breast cancer, you will assign individual codes for each breast. There is not a bilateral breast cancer code. So, when we talked about the ears or the eyes, we had a 3 for bilateral, meaning both ears or both eyes. Well, when you're coding neoplasm breast cancer codes, or breast cancer codes in the neoplasm category, there is not a code for both breasts. So if you're reading a medical chart and the patient has cancer in the left breast and the right breast, you're going to use both of those codes to assign. You're going to use both of those codes to reflect that condition. You're going to use the left breast code and the right breast code. Also understand that there are different ICD-10 codes for female breast cancer and male breast cancer. A lot of people don't know, but men can also get breast cancer as well. So let's talk about the commonalities of unspecified codes. I'm not sure if you noticed or not by now, but most of your unspecified codes is going to be .9. So if you're reading on your exam, a medical chart, or anything like that, or whatever, when you see that .9, not all the time, but just about 9 times out of 10, when you see that .9, and again, always refer back to your books and make sure, even if you think you remember these codes, always refer back to your book to verify, or your encoder to verify to be sure. See how this is a trend of .9 and it being unspecified? I-50.9, heart failure unspecified. A-19.9, military tuberculosis unspecified. G-62.9, polyneuropathy unspecified. J-18.9, pneumonia unspecified. N-84.9, polyp of female genital tract unspecified. Now, again, I want you to listen to me. This commonality does not always apply. So I also wanted to give you some examples with .9 codes that did not reflect unspecified. B26.9 is mumps without complication. Kind of like the diabetes E11.9, which is diabetes without complications. So mumps without complications is B26.9. K42.9 is umbilical hernia without obstruction or gangrene. K68.9, that's other disorders of the retroperitoneum. So you see those .9 did not fall into that category of that's unspecified commonalities. However, like I said, more than likely, 9 times out of 10, when you see the .9, they do have that in common. Again, and I will go back. Most of your .9 codes are going to be your unspecified codes, but not all of them. Unspecified ICD-10 codes. Assigning an unspecified codes mean that the condition is unknown at the time of coding. Of course, we only go with what the provider has documented. If it's not documented, it's not reported. We cannot assume that they're talking about the left eye or the right eye or the left breast or whatever. It has to be written in a documentation for us to code it. Sometimes we have the option to query the provider to ask them for further specifications, and sometimes we have to code what we have. So if it is not documented in the medical record, then it will go down as unspecified. An unspecified diagnosis may be coded more specifically later if more information is obtained about the patient's condition. Likely, in most instances, insurance company would deny claims that come through with unspecified diagnosis codes, delaying revenue. They want you to be more specific. At times, medical billers will remove unspecified codes from insurance claim and request a coding review from the medical coding department to make sure that there is not another code that can be used. So now let's talk about ulcers, pressure and non-pressure, and the commonalities in those. So just as cancer or neoplasm has stages, ulcers have stages as well. So stage 1, pertaining to ulcers, this area looks red, feels warm to the touch, darker skin. The area might have a blue or purple tint. The patient may also complain that it burns, hurts, or itches. Stage 2, the area looks more damaged and may have an open sore, scrape, or blister. The patient complains of significant pain and the skin around the wound may be discolored. Stage 3. See those different stages? Stage 3, the area has a crater-like appearance due to damage below the skin's surface. Stage 4, the area is severely damaged and a large wound is present. Muscles, tendons, bones, and joints can be involved. Infection is significantly at risk at this stage. A wound is not assigned a stage when there's a full thickness tissue loss and the base of the ulcer is covered with slough or eschler as found in the wound bed. Pressure ulcers, which is also called sores, or you can call them bed sores. Pressure ulcers are caused by sustained pressure on the area of the body which cuts off blood flow. Bed sores are also called pressure injuries, pressure sores, pressure ulcers, or decubitus ulcers. Patients who are bedridden are the most susceptible to pressure ulcers. They are not able to move to alleviate pressure from the same parts of the body on a continuous basis. Most common bed sores by anatomical sites. They usually get it on the buttocks, the tailbone, hips, heels of the feet, shoulder blades, back of the head, backs, and sides of the knees. Again, if someone is constantly laying in the same spot, primarily a bedridden person, someone's in a nursing facility, that's why they have to be turned like every few hours or every so often to keep the pressure from their skin. Because when they're not being turned or moved, the pressure from what they're laying on can break their skin down and cause sores and wounds. So here's a shortcut to staging pressure ulcers. There is a 0 on the end, it's unstageable. 1, stage 1. 2, stage 2. 3, stage 3, pretty self-explanatory. 4, typically stage 4. Then when we get to 6, that means there's deep tissue damage. 9 means unspecified stage. That means the stage is not specified in the documentation. Now here are examples. Now we have L89, that category. That's where you're going to find your pressure ulcer codes, L89. Pressure ulcer of the elbow of the unspecified elbow, stage 1. You see how it ends with a 1? Ends with a 2, stage 2. L89003, stage 3. L89.004, stage 4. L89.006, deep tissue damage. Deep tissue damage. L89009, here's the .9. We talked about it again, although the 9 is all the way at the end. But L89.009, this is unspecified elbow, unspecified stage. So again, just so you will see, and again, this presentation will be available on Gumroad for you to collect, and you can go over again as you watch this presentation. 0 is unstageable. 1, stage 1. Stage 2, 3, stage 3. Ends with a 4, stage 4. End with a 6, deep tissue damage. End with a 9, unspecified. And what you can do is you can just go through your L category and go through your L89, and you will see exactly what I'm talking about. There's going to be different anatomical sites. Pressure ulcers of the elbow, the hip, the left hip, the right hip, the buttocks, the elbow, just all different. L89 is where you're going to find it. There are also excludes 2. Now, if you do not know what excludes 1 and excludes 2 is and how to read those, make sure you go through the videos and look for the videos specifically explaining excludes 1 and excludes 2. So here are the excludes 2 codes for pressure ulcers. So now let's talk about non-pressure ulcers. You know how sometimes when people get diabetes, they have to get their foot cut off or their toes cut off. That's because they've lost circulation to those parts of the body. And it has nothing to do with pressure, like pressure ulcers. It has nothing to do with pressure being on it. It has everything to do with the condition that they have and the breakdown that's going on inside of their body with the circulation of their blood flow. And that can cause ulcers as well. So non-pressure chronic ulcers are like pressure ulcers in that they both require documentation of the site. So when we're reading the documentation for ulcers, their provider needs to put the site, the severity of their ulcer, and the laterality, left, right. Severity, the stage, the site, where it's located. So category L97 and L98 are for non-pressure ulcers and have an instructional note to code first any associated underlying conditions such as gangrene. I always read your instructional notes. I often get the AAPC book. I'm gonna say often. I always get the AAPC ICD10 book, being that I have AAPC certifications. That's the exam that most people are taking. So it just seems only right to get the book that they have for you, because there are a lot of things in that AAPC ICD10 book there are not in other ICD10 books that are very helpful for you. If there is poor circulation, such as that caused by venous or arterial insufficiency or excessive moisture or trauma, a patient might develop a non-pressure ulcer. Skin ulcers are open sores or wounds that develop on the skin. Symptoms may include skin ulcer, blister, pus. Venous ulcers are wounds on the leg or ankle caused by abnormal or damaged veins. Symptoms include leg ulcer, pain, skin redness. Shortcut to staging non-pressure ulcers. Remember, there is a difference between pressure and non-pressure ulcers. So if it ends in a 1, that means it's limited to breakdown of the skin. 2, fat layer is exposed. 3, it has necrosis of the muscle, and we know necrosis is when it's dead. It's necrosis means died or it's dead. So when someone's foot turns black or something like that, it's necrosis. So if you see a 3 at the end, that's with necrosis of the muscle. 4, necrosis of the bone. 5, muscle involvement without evidence of necrosis. 6, bone involvement without evidence of necrosis. 8, other specified severity. When you see this other, that means you're going to use this code, whatever the other code is, when there is nothing else there to use. So if neither one of these apply, that's when you use the other specified severity, because the provider specified the severity. However, it's just not a code for this specific severity, and that's when you will use other. So here are examples. You see here we have a 1 on the end. and it's limited to breakdown of the skin, just like we had here. Limited breakdown of the skin. Here's a 2 on the end with fat layer exposed. 3, necrosis of the muscle. 4, necrosis of the bone. 5, with muscle involvement without evidence of necrosis. If it ends with a 6, with bone involvement without evidence of necrosis. Ends with an 8, other specified severity. The severity is specified in the documentation, but it doesn't fit any other of these codes. And 9, of course, with unspecified severity, meaning that the provider did not specify the severity of the ulcer. So here it is again, if you want to take a screenshot. Shortcut to staging non-pressure ulcers. 1, at the end, limited breakdown. 2, with fat layer exposed. 3, necrosis of the muscle. 4, necrosis of the bone. 5, with muscle involvement without evidence of necrosis. 6, bone involvement without evidence of necrosis. And 8 on the end, other specified severity. So here are the references that I used for this presentation. The AAPC Expert 2024 edition, the World Health Organization known as the WHO, WebMD, and also Johns Hopkins Medical University, or Johns Hopkins University, or Johns Hopkins Medicine.org website. The way to get started is to quit talking and begin doing. Thank you so much for going through this presentation with me. On behalf of Allied Health Prep Academy, here is the website, alliedhealthprepacademy.com. Here's the email address and phone number if you would like to reach out and contact us. Thank you so much. Drop your questions below, and I'll be happy to answer any questions that you may have. Thank you.